filled with lots of unknowns. Now, here to talk more about this is Dr. Rawad Elias, and he's a gastrointestinal oncologist and medical director for Geriatric Oncology at Hartford HealthCare. Thank you very much for joining us.
Thank you for having me.
You bet. Well, talk to us about gastrointestinal cancer. How common is this type of cancer, and what are the signs and symptoms?
So gastrointestinal cancers include any cancer that starts in the digestive system. So that means from the esophagus all the way down to the rectus and anal area. They are common. They're about 25 to 30% of all cancers, and unfortunately, they're the second common cause of death from cancer. They're complicated cancers, and the symptoms will depend on where the cancer is starting. So if the cancer is starting, let's say, in the stomach or in the bowels, anemia related to blood deficiency, related to blood loss is a common manifestation. Weight loss is a common manifestation. Patients who have liver or pancreatic issues will also present with jaundice. So it depends on where it's starting from.
All right, so at what point in time should one get screened for this type of cancer?
The only cancer where we have a standard kind of blanket recommendation for screening in terms of gastrointestinal cancers is colon cancer. And the recommendation is for anyone who's aged 45 and above to go get a colonoscopy. An important thing to mention here is that we are seeing an increasing incidence of colorectal cancer in patients who are even less than 45. So if someone notices that they're having blood in their stools, changes in the bowel movements that's not explained, it's still important to go and get screened to make sure that there isn't a cancer that's evolving. The other cancers like pancreas cancer, stomach cancer, liver cancers, those are screened for in certain particular situations. So if there is a family history, if there's a genetic disorder, for example, then we go looking for them. Patients who have liver cirrhosis or history of hepatitis should be screened for liver cancer.
Now, you kind of touched on this just a moment ago, but what can patients expect when they get a GI cancer diagnosis?
So GI cancers are very complex cancers, and they require really management by multiple specialties. So it's important that you are evaluated by a team, a dedicated gastrointestinal cancers team that includes medical oncology, that includes radiation oncology, and surgeons. It's important to explore all options, and it's important to explore also clinical trial options.
Now, I understand that you have an event that's coming up. Quickly tell us all about that.
Thank you so much for asking about that. So it all started with a patient who was receiving their cancer treatments with me, and they asked, do you have a support group? And my answer at the time was no. And that patient was generous to support the initiation of a support group dedicated to patients with digestive cancers. The goal is to meet monthly. We meet on every Thursday of the month at noon to talk about topics related to cancers of the digestive system. A lot of the things that happen that are related to the cancer or the treatment, regardless of the site of the cancer, are shared among patients with gastrointestinal cancers. So we meet, we talk, we have a dedicated session to talk with a professional about some of what they're going through. And then we have also free time to talk with patients and see what they are thinking and how we can support them.
All right.
I think the next session we have is going to be April 21st, so in a week.
Okay, a very interesting topic. Thank you very much, Dr. Elias, for joining us.
Thank you so much.
You bet.